Hi everyone, welcome to episode 17 of Let's Talk Mental Health. On today's episode, we have someone very dear to my heart. She is a physician assistant and a substance use professional. Above all, she's one of my very best friends. So join me, let us welcome Miss Philimena Mieh Blidi. She'll be teaching us today about substance use disorder.
Hi everyone, my name is Miss Philimena Mieh Blidi, a physician assistant and an addiction professional. On today's episode of Let's Talk Mental Health, I will be talking about a mental health condition that is affecting the younger population globally. Today, I will be talking about substance use disorder or drug addiction. What is drug addiction? Drug addiction is a chronic brain relapsing disease that has to do with the compulsory use of the drug that an individual becomes dependent or tolerant on the drug. What causes drug addiction? Drug addiction is caused due to several factors, and these factors include environmental factor, early exposure to the drug, and peer pressure, genetic factors, family history of drug addiction, mental health conditions such as post-traumatic stress disorder, trauma, anxiety, and depression. Also, lack of parental supervision or guardian supervision can lead one into addiction. Can drug addiction affect an individual? Yes, of course. Drug addiction affects an individual mentally, physically, and their psychological state, thereby affecting their mood, sensory perception, thoughts, and behavior. What can I see to know that an individual is a drug addict or a substance user? According to DSM-5 criteria, the signs and symptoms for drug addiction include taking the drug in a larger amount over a longer period of time, trying to stop using the drug but yet still unsuccessful, recurring use of drug in a physically hazardous situation. Due to the drug, an individual failed to fulfill his obligation at school, home, work, or to his or her family, and craving that has to do with strong and intense use of the drug. Well, one may wonder, what are these drugs that an individual get addicted to? There are categories of drugs that people get addicted to. And these categories include depressants. Examples of depressants are alcohol and benzodiazepine. Another drug includes stimulants. Examples of stimulants are cocaine and methamphetamine. We also have opioids. Examples of opioids include tramadol, morphine, and codeine. They have the hallucinogen. Examples of hallucinogen include ketamine and psilocybin. They also have cannabis. Examples of cannabis include marijuana or weed and edibles. They have inhalants. Example of inhalants is fentanyl and nicotine product. Example of nicotine product is cigarette, cigar, vapes, hookah, or shisha. These are the category of drugs that people get addicted to. One may wonder, since drug addiction is a chronic brain relapse disease, can this condition be treated? Yes, of course. Drug addiction or SUD can be treated by using the following method. The detoxification process or the detox process help an individual get rid of the drug within their body. We also have the counseling and the therapy treatment that is used by counselors and social workers by using the CBT, which is the cognitive behavior therapy, and the MI, which is the motivational interview. Another method is the MAT, which is the medication assisted treatment. This method is used to substitute the drug that an individual is addicted to with another drug. And then we have the support group, and lastly, rehabilitation center. The rehabilitation has two parts. They have the outpatient and the inpatient. And this is decided upon by the professional individual that is seeing this person. By deciding on this, you use the assist tools to know if the person is a mild user, moderate user, or severe user before placing them into outpatient rehab or an inpatient rehab. To conclude on today's topic, substance use disorder can be treated. Early help, better recovery. Let us all work together to break the stigma of this mental health condition and help people recover from drug addiction. Thank you.
Thank you so much to my best friend goals. Find a best friend I can lean to. And that's about it for today's video. I hope you learned like I did. Remember, an informed mind leads to a changed behavior. I am Merva M. Smallwood, and until our next episode, adios.